28% of people with bowel cancer will get it because of diets low in fiber. This is how much fiber an average adult needs. It's about 30 grams per day. This is why diets too low in fiber are commonly seen in cases of bowel cancer. Fiber acts like a bit of a sponge and absorbs harmful chemicals. It helps you poop more frequently, which means that these harmful chemicals that can lead to a cancer spend less time in your bowel. Fiber also feeds the good bacteria in your bowel and acts like a scrub brush to clean out the bad bacteria, which can only be good in reducing your overall cancer risk. Some good sources of fiber include your whole grains such as nuts. You've got your seeds, brown rice and bran flakes. You've also got things such as oats, pulses such as lentils and beans. Also, don't forget our fruits and vegetables. Bowel cancer can happen at any age. Did you know that bowel cancer rates are increasing in younger adults? I've seen this myself in clinic where we seem to be diagnosing this severe disease in much younger patients. This may be due to many things. Diets these days consist of mainly processed or ultra-processed foods, which can cause damage after several years. You've also got to acknowledge that lifestyles now are so much more sedentary than what they were generations ago. It is clear that bowel cancer is no longer only a disease of the elderly, which is why everyone needs to be aware of the symptoms to look out for.
My name's Thomas Hunt, and at 27 I was diagnosed with colon cancer.
Hi, my name is Peter Marinaro. I am 40 years old. I am a stage 4 colon cancer patient, diagnosed at the age of 37.
I first thought that something was wrong after we got back from a trip, and I thought I'd contracted some sort of stomach bug. I had a tumour that's in my colon that split the colon.
So, what kind of symptoms do you need to be aware of? Unintentional weight loss, persistent change in your bowel habit that is not normal for yourself, persistent tummy pain and bleeding from the rectum or blood in your stomach. You see, around 90% of people who have bowel cancer will have one or a combination of these symptoms, which is why it is so important to get checked out if these symptoms are persistent over several weeks. As well as being examined, your doctor will likely arrange a test known as the FIT test, also known as the fecal immunochemical test. This test is done if you have any concerning symptoms that we discussed just before. You see, FIT is a test that looks for blood in a sample of your poop. It looks for tiny traces of blood that you might not be able to see with your own eyes, and this could be a sign of cancer. In our next fact, bowel cancer screening saves lives. It can detect cancer even before your symptoms appear. We talked about one of the tests, the FIT test. Bowel cancer screening is offered to everyone aged 54 to 74 every 2 years, and it will soon be available for everyone aged 50 to 74 years old. So you may be sent a home test kit now if you're aged 50 or over. This is because your risk of getting bowel cancer gets higher as you get older. And finishing off with our last fact and the good news, this is that bowel cancer is treatable, especially if caught early. So when diagnosed at an early stage, more than 90% of people, which is most people, will survive 5 years or more. That's why awareness is key. If you notice symptoms like blood in your poo, changes in your bowel habits, or an unexplained weight loss, don't wait. See your GP. So, it's Dr. Derek here. Don't forget to leave a like and subscribe if you found this video helpful. I've also attached a link to our other videos that I think you will find helpful. And as always, I truly care about your health, and I wish you the very best.